And the country has only 1 month's supply of the life-saving drugs for the 900,000 Kenyans under the 3-drug treatment regimen. This comes after the Ministry of Health cited lack of communication from USAID regarding the ARV consignment that is stuck at the port. Despite the ministry insisting that there is no patient who has missed their medication yet, Kenya has for the last 1 month lacked early infant diagnostic kits that could lead to late treatment for infants infected with HIV. And as Raquel Mwangangi reports, it is still unclear when the consignment of antiretroviral drugs that is stuck at the port of Mombasa will be released to the Kenyan government for distribution through the Kenya Medical Supplies Agency.
For the over 1.2 million Kenyans living with HIV and AIDS, the fear of when they will lack their ARVs medication still looms, as the drug consignment donated by USAID through a private company is still stuck at the port of Mombasa. Even so, according to Dr. Mwangangi, the Chief Administrative Officer at the Ministry of Health, the country has had a challenge in matters early infant diagnosis for the last 1 month. In quote, "We do have a stock out right now of what is required to conduct infant diagnosis in HIV. Lack of that diagnostic feature then poses a risk in ensuring our children will be protected from transmission or that they get medication they require in due time."
Very comfortable.
The recent stockout has been occasioned by the standoff between USAID and the government of Kenya over what correspondence indicates is USAID's desire to have Chemonics International, the private company through which they procured the donations, handle distribution in the country. Generally, the consignee of the donations has always been KEMSA under the Medical Commodities Project, which the ministry says has received global applause.
On the decision of Chemonics, that was actually a unilateral decision made by USAID with no formal communication to us to date on any intent to use a different agency, on any justification, any explanation, on any point of recourse that they required from the ministry for us to be able to follow that route.
Last week we agreed that we're also going to invite the USAID. And yesterday I received the communication from the clerk of the National Assembly saying that the USAID have diplomatic immunity and so we cannot summon them.
Despite engagements with the country through the Ministry of Foreign Affairs, the ministry indicates USAID has chosen to remain silent on the matter.
Yes, we have been happy to know what issues they are trying to evade because it is important for us to know the problems that they are trying to solve.
While the ministry is now depending on the consignments set to arrive in the country in mid-May as well as mid-April, long-term plans to make Kenya self-reliant are underway, especially one of having an emergency fund in place to enable procurement of the drugs.
We're working on policies for local manufacturing as highlighted, and also engaging with other partners to ensure that they can also support this pipeline.
At the moment, the ministry says 1.8 million a month supply of ARVs is available for 900,000 persons who are under the TLD regimen, a treatment combination of 3 drugs. Raquel Mwangangi, Citizen TV.